Hello, welcome to another Dr. Foot video. In this video, I'm going to be talking about a condition that affects a lot of people, which is osteoarthritis. Osteoarthritis is a degenerative joint disease that causes pain and a loss of mobility or joint function. It can greatly diminish the quality of life for the person that has it, particularly when it affects small joints such as the ankle and the big toe. Osteoarthritis is one of the most common conditions. It's only second to cardiovascular disease for producing chronic disability. Now, as we used to think, osteoarthritis is not a passive wear and tear type of condition. It is an active disease. It has a complex underlying pathology. There are 3 stages of osteoarthritis. It first starts off with a slight stiffness after lying down or sitting down for a while. And this is usually the first indication of osteoarthritis. So you'll wake up in the morning and your knees will feel very stiff and your ankles can feel very stiff. Obviously, it can affect other joints, any synovial joint, but this stiffness can soon go away and you can get moving again. As osteoarthritis progresses, these joint movements will become continually painful. So it won't take 5-10 minutes before you can loosen up that joint. It can take a few hours. And patients often say that the joint feels like a gritty sensation. So I've had patients explain to me like they feel as though they've got sand in their joints. It's that kind of grit that they feel. And that can really reduce the range of motion. So you'll find that you can't really straighten out your joints, your knees or your ankles. You can't move it the way you used to. Now the last stage of osteoarthritis is when you get joint degeneration and the joints become very painful even when you're resting. So you'll be resting at night, sleeping at night in bed, and they're still painful. You can also get inflammation and swelling around the joint. So you can get edema, you can get fluid building up around the joint. There are some other factors that may accelerate the natural wear and tear of the joint. Let me just have some more coffee. Okay, so being overweight, being obese can accelerate this wear and tear. Inflammation caused by other types of conditions. Incorrect joint alignment has been stated, but I'm not convinced. But nevertheless, it has been stated in a few papers. Sporting activities that carry a higher rate of injury can also be a contributing factor. And working in an environment where you're constantly lifting, carrying, or doing the same repetitive motion over and over again can lead to osteoarthritis or wear and tear of the joint. So what actually happens inside these joints? Why do these joints become painful? Why are they so stiff? Well, it's all down to a substance in the synovial joint, in the synovium. Now it can affect your knee joint, your hip joint, your ankle joint. It can affect your shoulder joint. It can, as podiatrists will tell you, it often affects the big toe. Your big toe takes all your weight during your walking cycle. So if it's not functioning properly, you can develop arthritic changes within there, and it can also be caused because of trauma. It can also affect the midfoot, which is not as common, but it can affect the midfoot. Now, what happens to the synovium? What happens inside these joints? It's all down to a substance called sodium hyaluronate. Hyaluronic acid, I prefer to say. It's abundant in synovial fluid, and it's not there for your entire lifetime. It's constantly being broken down. It's constantly being replaced. There is an exact balance between the breakdown of the old hyaluronic acid and the production of new hyaluronic acid. However, in osteoarthritis, this balance is disturbed. There's a breakdown. the breakdown happens faster than the production, basically. As a result, the synovial fluid becomes watery and it stops working properly. Now, due to the change in synovial fluid, and for other more complex reasons, the cartilage in the joint gradually wears away in some cases. In some places, in fact, the cartilage may completely disappear altogether, and there'll be thinning of the synovial fluid, and wearing away of the cartilage causes these symptoms which I spoke about before, that pain, stiffness, swelling. You won't be able to do the activities that you want to do, going for long walks, going to the gym, doing a sport that you enjoy. So it can really affect a patient's lifestyle. Hyaluronic acid in the joint becomes depolymerized and fragmented. The synovial fluid becomes less viscous, and most importantly, it stops, the shock absorbing properties of it are reduced. And synovial fluid also has a function where it filters away some of the inflammation in the joint. So as I was saying, the coating over the surface of these joints breaks down, leaving the cartilage exposed to more mechanical and inflammatory damage. The synovial membrane becomes inflamed. The cartilage is then gradually destroyed. It's a terrible cascade of events for the patient. When the patient comes to me, they're often quite distraught. Now, we all think osteoarthritis only affects old people. We only think it's going to affect us when we're... See, I don't want to use a number here, because then you'll say, if 60-year-old is 70-year-old, but whenever you're old, whenever you think that, okay, between 60 to 90 to 100 is old, but I have seen younger patients in their 20s and 30s, where they've had chronic ankle or knee pain, and I've sent them off for x-rays or MRIs, and they've come back to say they've got stage 2 of osteoarthritis, or they've got osteoarthritic changes happening. This can be because of a variety of different things. As I've said before, sports or jobs, or being overweight, abnormal joint development. There's a whole variety of reasons why somebody younger can get osteoarthritis. And a lot of it for me is patient education. One is trying to demystify osteoarthritis, because I think a lot of my colleagues, and especially doctors, it's almost like they're giving a patient a life sentence. Movement is lotion. You need to keep moving, because the more you move, the better your symptoms will be for osteoarthritis. So apart from the rehab and the orthotics, I also do hyaluronic acid injections into the joint. I use Ostenil Plus for knees, Ostenil for ankle joints, and there's another Ostenil Mini for the big toe, which is an injection I don't enjoy doing because it's so difficult, but I do it. So what happens after I inject hyaluronic acid into a joint? Well, the viscosity of the synovial fluid is restored, and its shock absorbing properties are also restored. Also, the filtering properties to filter away inflammation also is restored. In addition, it reestablishes that protective coating of hyaluron over the inner surface of the joint, and increases the removal of the free radicals. I find Ostenil injections very, very helpful. They can give a patient 12 to 18 months of movement and being able to do their normal lifestyle, being able to do their activities that they want to do. As I said, the hyaluronic acid can reduce the inflammation within the synovial membrane and can be very, very helpful. It's not a magic bullet. You still need to do exercise, you still need to move, you still need to do some movement in that joint, and it depends on the stage of your osteoarthritis. Hope you found this video helpful, and I shall speak to you soon. Take care. Bye.